is it?
You, we're ready to roll.
All right, thank you guys. I'm just going to repeat this for the record. So we've got one member who's running late. So I reserve the ability to adjust some of our agenda as we go through it, since there's some important topics that we'd like as many members present as possible. So with that, we'll proceed. Is there a motion? We'll move on to the minutes from April. Is there a motion to approve April's minutes?
I move we approve April's minutes.
Is there a second? I'll second it. All those in favor say aye. Aye.
Elliot's
muted.
Elliot, you're on mute. Hopefully he can hear us.
Elliot, can you hear us? Okay, well, the motion passes with 2 votes.
Yeah,
There he is.
yeah, all I
Oh,
wanted
there
to
you
say,
are.
yeah, all I wanted to say was I wasn't there, so I can't vote on the minutes, so,
Ah, got it. Thank you, Elliot.
yep, thanks.
All right. I assume is there anybody signed up for public comment? I don't see anybody on Zoom here.
Here comes Annie.
Hello, Ann.
Didn't really sorry to be late. Is this an extra?
Yeah.
It's over here, Ann.
I don't see anybody in the chat area, so it doesn't look like we have anybody online for public comment. Morning, Ann.
Good morning.
And I assume there's nobody in the room with you all.
No.
There is none.
All right, then I will continue on with the agenda. All right, we'll move on to unfinished business. Appeal process for the on-site disposal permits. Dr. Reedy, do you want to proceed with that, or were you waiting for Nathan to join?
I think Nathan may be joining.
Okay,
You just move that till when he comes, and if not, I can address it later.
sounds good. Thank you. Then we'll move on to the proposed increase in environmental fees for fiscal year 25.
Okay. So you all should have received a copy of the current fee schedule and the proposed fee schedule, as well as the printout with the current and proposed next to each other. So you can see what the difference in fees would be. Also, I sent a justification with some of the things that you were asking for at the last meeting. The last time the permit fees were increased was November 1st, 2020. That was about a 20% increase. I can't find documentation on when the last increase previous to that occurred in Jefferson County. However, the last time the state set a new maximum in what used to be 64 CSR 30 prior to 2020 was in 2006, and we would not have been able to be above that maximum that they had set then. Staff salaries have increased since 2020. In 2020, we had one less sanitarian. We've since added a position that will no longer be funded by the NEHA grant by the end of this year. Our total EH salaries in 2020, including an estimate of the benefits, was $325,000. Current staff, EH staff salaries, including benefits, is $389,000. And that number is likely to go up in fiscal year 2025 due to some staff raises. The total mileage reimbursement in fiscal year 23 was $10,485. That was a number that was asked for. That number is going to be much higher in fiscal year 24 and 25, I'm sure, because we now have 4 fully trained sanitarians, and this number was 23, where we had 2 to 3 sanitarians. Revenue from the EH fees for permits and services was $307,000 in fiscal year 23. And based on the budget estimate for fiscal year 25, the proposed increase in fees could bring that revenue to about $365,000. And that's a conservative estimate because some fees remain the same. NEHA grant funding, Ann Nguyen had asked to see this. So our 3-year, $228,000 grant, which was $76,000 a year for calendar year 22, 23, and 24 is basically that money's already on the books. It came in fiscal year 24. We won't see any more of that money. The mentorship grant will be paid after it's completed in fiscal year 25. That's $24,000 grant that'll be paid after the end of this calendar year, as well as the travel and training grant in the amount of $5,500 and the special project grant in the amount of $20,000. And those grants don't really reimburse staff salaries. They're for other deliverables. So we don't know yet what grant funding might be available in calendar year 25. We haven't seen that yet, but it's not likely that we'll be able to obtain another large grant like that 228,000 grant that we received, because we're already meeting 7 of the 9 standards and we plan to meet the other 2 standards by the end of 2025. And so by the end of this calendar year, salaries will only be paid out of the general fund. And I would estimate that a sanitarian spends about 5 hours on well and septic inspections. That's probably the lower normal end of the spectrum when there's no problems, and about 3 hours on food and general inspections. And those estimates include travel time and paperwork. It doesn't include things like plan reviews and all of that staff do as well. So without additional funding from the state or the county and anticipating less grant funding in fiscal year 25, increasing fees is a way to increase our revenue and help keep the health department from operating at a deficit and having to cut staff positions. So, basically, what I am asking is that you approve to put this out for public comment. And another point, is Berkeley County has already had their increase in fees approved, and they're putting forth pretty much the exact same fees that I am proposing right now.
Yeah.
Thank
so
you for this, Gillian.
Yeah, this is really great.
Yeah.
Thank you. This is exactly, I think, what helps us kind of wrap our head around it. A couple things on the current versus proposed documentation. This is great. This kind of paints the picture for us, but I'm just thinking for public comment and maybe for outside use, I would just recommend a couple changes to consider. Some of the things that I see just quickly, and I can notate this if you want, but again, this is really, really good. The last time the permit fees were increased was November 2020. That was when the state allowed us to increase, right?
Yes,
So we made that change when the state allowed us to.
yes.
And the state hadn't allowed us to since 2006.
Apparently not. When you go online to the Secretary of State website that has all of the rules posted, the last time that 64 CSR 30 rule was changed was 2006.
Mhm.
So, and that rule is what used to set the maximum fee limits.
Yeah,
So that was that, sorry, just but for clarification, that was the maximum. So we may or may not have made adjustments up until that maximum, correct?
Yes.
Yeah.
Okay, I understand. Yeah, and just so maybe the language with, I could not find documentation on when the last increase, like if this is gonna be.
That was for your.
Yeah, so I would just kind of remove that for
Right.
the public comment, or if this gets wheels outside of this meeting.
Mm-hmm.
On the EH staff salaries, that third bullet on the total mileage,
Mm-hmm.
much higher. In fiscal year 25, maybe we anticipate an increase in
Okay.
fiscal year 25. Minor stuff.
Okay.
The sanitarian estimate of 5 hours, that's an expense item, right?
Yes.
So I'd recommend moving that up next to EH staff salaries, so you kind of have the history of when we made those
Okay.
changes, 2006, 2020, the anticipated increase in expenses due to EH staff salaries and the sanitarian. And then the NEHA grant funding, is that kind of just saying that like it's unsure or it's not gonna be as much, like,
Yeah, we really don't know that the grant funding was also for your benefit because Ann Nguyen had asked to know how much of our salaries are paid by the grant
Mhm.
funding, but really they're not covering staff salaries right now. So other than the 3-year one that terminates at the end of this year. So that one was specifically for staff salaries. The others are for other deliverables. So. And we don't know, I was able to obtain that 3-year grant for working on the program standards, which we have done very successfully. And we almost meet all 9 of the voluntary national retail food safety program standards. So I'm not, and we just don't know yet. For one, the grant is open, that funding from CDC is open again this year for competition, so likely NEHA and NACHO will both be competing to get that grant funding again. And NACHO had a totally different way of providing funding than NEHA was, and we don't know how much the funding will be. But
so it's almost like the lack of assurances on the NEHA grant funding.
right,
And I don't know how best to word.
and it's
word that.
becoming a lot more competitive as well. So there's a lot more people that are applying for this funding now. So.
Yeah. So I just maybe just a little bit more context around NEHA grant funding, but what about it is part of the driving force around this? It's
Okay.
the lack of assurances around NEHA grant funding perhaps. And then just lastly, the revenue line item and then the without additional funding, like those should be kind of like the last 2 bullets, right? So timeline, expenses, lack of assurances on grant funding,
Mhm.
increase in revenue. This, it's a modest increase in revenue and the last line, we need this in order to make
Right.
sure we're not at a deficit. So just again, minor things, but phenomenal. Thank you. Sorry, guys, I just wanted to dig in on that.
And that's the CEO in you, right? You can't help it.
Yeah, I just can't help.
Looks like Dr. Reedy has a question. Go ahead, Dr. Reedy.
Just one opinion or comment, on the clinical side, we have grants that fund certain things that, and those are for discretionary programs like the QRT and other things. None of what the environmental is doing is discretionary, that's all required. So it was great to get this extra grant money and it improved, it was an investment, to improve the standards, not just for us, but to push the rest of the state to improve standards, but that the salaries are not discretionary. We have to fund them some way because our county, unlike most of the counties, is growing both with regard to building septic and well permits and new food service. So.
Yeah, I mean, maybe that's another bullet under the salaries, like these salaries are mandated or required for us to meet our mandate.
And in that area of the number of sanitarians, isn't a county of our size expected to have 4 or more sanitarians? And are we at that bullet point area?
So now with it 4 sanitarians, basically for the program standards, there's a formula calculation that you do to find out if you meet the minimum staffing requirement to be able to do the minimum number of food inspections that's required. And right now we do. So if we had one less staff member, we would not. So. Yeah, but the estimate, Gina was referring to another estimate that NACHO or somebody did, basically saying based on the population of our county, it would be beneficial to have 1 more sanitarian. So 5 field sanitarians instead of 4. So.
We'll cross that bridge when we
Yeah.
can.
So.
Yeah, but I think it leads credence to, it's like, we're not
We're not loaded.
overstaffed
We're
for
not
this.
loaded,
If
yeah.
anything, studies show that we're understaffed at our current rates and maybe reference both of those studies. I think it just adds a little bit more to this.
Agreed.
Okay.
More questions, please.
Any other questions?
So there's no fee
Nope,
increase.
just reiterate.
20%. Other than, because there's no green, right? If there was green, then, so 20% is the maximum. Oh, thank you. So
There was
that-
one, yeah,
Two
so,
slides.
yeah, so, yeah.
It's not-
It's much more complicated.
There is one green. It's not really, but yeah. So there's one, these, and I will say that these are the same fees that I believe Berkeley County put forth because they're the fees that the state actually recommended when counties were adopting their local ordinances. So I didn't make up any of these numbers. It was numbers that were recommended by the
Yeah.
state.
So I
Include
recommend,
that too.
I put a bullet here for any fee increases over 20% were done based on state recommendation.
Right.
I would add that.
Right.
Okay, yes.
Oh,
Any other questions for Gillian?
So repeat your request, Gillian, just to make sure that we all understand.
So basically my request today, if there is no more questions, is that you vote to put the new fees, the proposed fee rule forward for public comment.
I move we put the proposed fee rule up for public comment.
Second.
Any discussion? Hearing none, all those in favor say aye. Aye,
Thank you.
right.
And
Thank you so much for that, Gillian. You did a great job.
Just
Phenomenal.
since I'm the recorder and couldn't tell well, Elliot and Karen, what were your votes? I couldn't.
Aye.
Aye.
Okay, thank you.
All right, I see that Nathan's on, so I'm gonna move back over to the item above on the
Hi.
appeals process.
Hello, sorry, I signed on right at 9 and my computer, of course, told me that my Zoom app needed to be updated. So I had to do that for a few minutes and then I tried to sign on it. I don't know, somehow it didn't connect for a little while, so. Yeah, we've been talking about this whole appeal process. I was able to make some progress this month in that I contacted the State Board of Health, and I also contacted some attorneys that deal with health issues in the Attorney General's office. And they're entering into some discussions about this. I don't really have a complete answer yet, but you know, they are looking at some of these issues. It's one of those areas of the law that is a little, I think the local board of health certainly has the authority to adopt rules. They are just checking into what they think governs that. And I'm hoping that by our next meeting, I will have some more input from them and I can report to you what they've said. Quite frankly, I think that our local rules, you know, are fine. I think they're legal. The statute does seem to give the local board of health authority to have those kind of procedures. I guess our real question is, do they need tweaked any just to make them a little more I guess I would just say we want to make them as user friendly as possible and also give the public the ability to, you know, have some sort of an appeal of a decision that is meaningful. So anyway, we're working through it. I have been able to contact some of those folks and hopefully we can have something wrapped up by the next time.
Thanks, Nathan. Dr. Reedy, do you have anything to add at this point?
I do not. We'll continue with our current rules and citing to any people who've asked for an appeal. We'll let them know both legal, rules.
Okay, thank you. Any other questions from Nathan or Dr. Reedy on this?
None here.
None.
Okay, thank you, guys.
Ms.
All right, moving on.
Ms. Chapman, I am working on a number of projects. I don't really see anything else in the agenda that would require my presence. So I may sign out if that's okay with you. Most of
You're
it is
excused,
just
Nathan.
financial stuff.
Thank you. No,
Okay,
appreciate it.
thank you
Thank you.
so much.
Thanks for your help.
Thank
All
you.
right, we'll move on to new business with medical cannabis. Dr.
Yeah,
I
so
assume that's yours, Dr. Reedy?
I'll take
It has
it.
medical
So
in the title.
we had another letter from the medical cannabis part of the State Department of Health. And it's the same firm who had requested an address change about 2 months ago that we signed off on that. That was for a grower permit. This is for a processor permit at the same location, same company. So that's the only difference is this is for a different license. And I had given Brandon a copy of the wording that we used in the letters previously on our approval.
Yeah, it's in the packet as well.
Oh, okay.
This,
So
the
it
letter,
does have
yeah.
the language that's been consistent with what we've had before. I don't have this side by side of our previous ones, but I know we had put some disclaimer language in there about sort of what our authority is and what our authority isn't, and that we're acting based on the authority that we believe to have based on their request.
That's right.
You want to just?
Yeah, I can read it for the record, sure. So the statement that adopted by Jefferson County Board of Health is approval means that there are no Jefferson County Board of Health regulations that are being violated by the entity's existence. The board makes no determination or representation about the entity's conformance or compliance with any other local, state, or federal law, regulation, or ordinance.
I guess we just need a motion and adoption by the board, approval by the board.
Yeah, I move that we approve this request.
Second.
Is there any discussion? All those in favor say aye.
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 None opposed. The motion passes. Thank you.
Thank you.
Sorry, I'm working from a single screen, so I'm flipping between screens here, guys. Bear with me.
Your words.
Back to the Stone Age.
I know, right? I'm like, I don't have 5 screens in front of me. I can't function. All right, we'll move over to Charlie.
Good morning, everyone.
Good morning.
So we have the March financial report and the preliminary April financial report. Starting off with March of 2024, we are 75% through the fiscal year. Bank balance approximately $308,000. We are not in compliance with reserve requirements by $91,000. We will see that change in April. Giving a little bit of a preview there.
Thank you.
Financial summary, looking at March 2024 alone, revenue almost $247,000. We're going to reduce that by salaries and wages of $86,000 and operating expenses of almost $15,000, leaving us a surplus for the month of March of $145,700. Fiscal year to date. Revenue, $1.2 million. We're gonna reduce that by salaries and wages of $891,000 and operating expenses of $312,000. Leaving us a surplus through March of 2024 of $29,976. Going to accounts receivable, $602,000. $525,000 of that is West Virginia Treasury. Also a little bit of a preview, that's gonna go down. In April, so the 87% of accounts receivable in March of 2024, West Virginia Treasury.
Number go up, number go down.
Just real quick, our actual fiscal year to date compared to budget, revenue is 8% above budget. Salaries and wages, 5% above what was budgeted, and operating expenses, 33% above what was budgeted. On the operating expense side, that is mainly the vaccine expenses. So we're generating revenue from that, and then the one-time renovations. So,
Do you have the dollar amount for that?
for
offhand?
which one?
For the operating expense over budget?
Oh, yeah,
You said it was 30% over?
33%.
Yeah,
And that is, give me one moment. As of March 2024, $22,759. For example, vaccine expenses, 48,000 over budget, but we're bringing in revenue because of that expenditure.
That number right there pretty much is the renovation amount.
okay.
Is it? Okay.
Yeah, it really is. It's
Okay.
pretty much right on the number for the renovation amount. Renovation amount was all told between the separate renovations, roughly about $23,000.
Oh, almost pegged, yeah.
Yeah.
So, but those were the main, there are
Those are your
items that are
expenses.
under budget,
Yes.
but so the renovations and the vaccines are what's over budget,
Okay. And salaries was 5% over?
5%.
Okay. Thank you.
And comparing to last year, right now, as of March 2024, surplus of almost $30,000. Last year, it was surplus of almost $24,000. So we're a little bit better, but comparable. Any questions on March 2024 before I jump into April preliminary?
Go for it.
All right. April 2024, we're 83% through the fiscal year. Bank balance, $379,000. We're in compliance with reserve requirements in excess of $42,578. Financial summary. April 2024 alone, revenue, almost $86,000. We're gonna reduce that by salaries and wages of almost $104,000 and operating expenses of almost $10,000. Leaves a surplus for the month of April of $72,000. Fiscal year to date, revenue $1.4 million. We're gonna reduce that by salaries and wages of $995,000 and operating expenses of $321,000. Leaves a surplus through April of 2024 of was $102,000. Comparing that to our budget, revenue is above budget by 12%. Salaries and wages above budget by 6%. And operating expenses above budget by 28%. Accounts receivable, almost $74,000. So not a huge decrease from last month, but we're gonna see the buckets have changed. West Virginia State Treasury, that went down to $370,000. All the other receivables went up. That's almost $204,000. That's due to the billings for permits and fees. And I took a quick peek at May. And as of today, accounts receivable is going down. It was $507,000 when I looked at it earlier today. So as a percentage, West Virginia Treasury is at 64% of the total receivable balance, and all the others 36%.
So real quick, go ahead, Ann.
Will these new permit and fee numbers, go in effect July 1st or?
So it'll be sometime on or after July 11th, depending on when they get approved. So if they're approved before July 11th, then July 11th will be the effective date. We get, because we allow the 10-day late. You can be up to 10 days late with your permit fees, and we don't want to institute them while people are paying the current
But if
permit
they're
fees.
paying them now, they're gonna pay them at the old rate, not the
Right.
new rate.
Right.
And would it depend on when the county commission actually approves it?
Yes. So first it has to be out for public comment for at least 30 days, and then the Board of Health has to vote to approve it after the public comment period, and then the county commission has to approve it within 30 days for it to go into effect.
And we'll make sure we push to get it done in a quick and timely manner. As quickly as we can.
But it doesn't. affect
If they,
this-
remind me if they don't, if the county commission doesn't act on them, so you say they have to approve them within 30 days, if they don't act, then it still reverts back to the existing rates?
This
Yes.
Pocket veto.
Yeah,
Okay, yeah.
Yeah, I wanna just
Yeah.
dig on the accounts receivable a little bit. So
Yeah.
percentage of significant receivables, the West Virginia Treasury is 370. The over 90, which isn't broken by payer, is 237. So does that stand to reason that, well, I guess I'm looking for like, what's the percentage of the non-West Virginia Treasury that's over 90 days? Like in my past, in my history and experience, like those commercial payers, the more age they get, the harder it is to collect them.
Mhm.
And I'm like, wonder, like, once you get past 90 days, 180 days, really, 90 days isn't terribly aged, but
That's 40%. For the 237,000, that's 40% of our receivable balance, but we will get that from West Virginia Treasury.
It's gotta be, it's probably 100% West Virginia Treasury, or darn near 100%.
Yeah, that's kind of where I was going with
And the
that.
reason I know this is because I'm pending grant payments from Q1, Q2 on 3 separate grants. And
Okay.
Q3.
All right, good, good. No, that's great. Yeah.
I've only received Q1 and Q2 payments on
Yeah.
on the threat preparedness grant. Those
Mhm.
just came in last week. And so I'm still waiting for probably somewhere in the range of about 200,000
Oh, I see.
in Q1, Q2 payments on at least 2 other grants and a Q3 payment on a 3rd grant.
Okay, all right.
So,
Yeah, I'm sorry, I think Gino answered, but I didn't fully comprehend what you're saying. That 237 is all West Virginia.
Yeah, that's kind of what I
Yeah,
was shooting
yeah,
for,
sorry.
is to understand that.
And then that 237 is 40% of the total receivable balance.
yes. Yes, sir. Well, we'll talk about that when we talk about the budget.
And then just quick comparison to prior year. As of right now, the surplus is almost $102,000. Last year, this time, the surplus was at almost $19,000. So much better than last year.
Gotta get it in the bank now. That's
Yep.
what's happening now. Gotta get it in the bank. We probably be sitting at about 550. If
Yeah.
a lot of those 90-day ARs came in, we'd be sitting somewhere in the 500 range.
See, and that's exactly kind of where I was going with
Yeah.
that. Until that hits the bank, it's AR and some of
Right.
these commercial, and I'm just dealing with it day to day with like United Healthcare and
Yes.
Aetna. Like it is brutal. And each month we take an aging debt reserve. We're almost kind of reserving and anticipating that a percentage of our AR is going to be.
Absolutely, you should.
Yeah, and I don't know if our volumes here, there's a justification or need for that.
For
But,
West Virginia Treasury.
not for West,
no.
for everything
The
else.
others, all the other receivables, yeah, there's gonna be a percentage we don't get.
Yeah,
That-
and do you
that's
account for
normal.
that a month over month? There's some kind of percentage allowance?
Month.
We tend to write it off anywhere from usually annually.
Uh-huh.
Yeah,
We usually,
Yeah.
and it's usually not a very, it's not usually significant. We're not talking about 5 figures. We're talking less than 5 figures,
Okay,
Mhm.
$8,000.
okay, yeah,
it is a
there's
small
a,
amount, yeah, because it,
that's great. I mean,
A
if
lot
that's
of-
if that's the amount that you're not collecting on AR, that's a testament to your collection effort, so.
Well, as we continue to build more and more insurance, it'll only
Yeah.
become more and more
It
difficult.
will, it will.
And that's as we get better at tracking our billing,
Mhm.
which is, you know, lots of different pieces as opposed to submitting one invoice for, you know,
$40.
$100,000 or whatever it is.
Oh, yeah.
As we get better in that and tracking the aging, as we get more and more, especially as we have diverse payers instead of Medicaid, which is our major payer right now. That's, and we've already started with family planning, program to be now billing the private insurances more than before.
Mhm.
New challenges coming.
Yeah, yeah,
For sure.
thank you.
any other questions?
Then don't we need to approve the March?
Yes.
Yep. Is there a motion to approve the March financials?
I move that we accept the March financial report.
I second.
Any discussion? All those in favor say aye. Aye.
All right.
Thanks, Charlie.
Yeah,
Thank you.
Charlie.
All right,
Thanks, Amber.
moving along to the March 2024. Oh, sorry, never mind, just kidding, we just did that. Going into the agency reports, please.
Okay, so environmental, first, I did want to say or let all of you know that I am moving out of state in June, so my last day here is going to be June 18th. I submitted my resignation to Gino a couple weeks ago so he could go ahead and advertise my position and hopefully get somebody hired before too long. That being said, my staff did about 173 total inspections and site evaluations last month. They did definitely increase their food inspection number last month. The septics went down a little bit and food inspections, the routine food inspections were up to 71 last month. And that's partly due to doing the casino over a couple days, and there's a lot of permits in the casino, so. I don't think I have anything else. We do have a conference coming up that a couple of us will be going to next week. But other than that, I don't think I have anything.
I don't know, man, maybe I slept at a Holiday Inn Express last night or ate my Wheaties or something, but like, I want to dig in a little bit on this and just,
Okay.
this is just curiosity more than anything.
Yep, that's fine.
This is the number that you do, and it's a 12-month average. Do you guys track in any way, like the average time to complete these from the time of the request was submitted? Like almost like a stat that measures the throughput of all of this.
So we do have, when applications are received, I mean, we have that, but we don't have like a tracking system for it. We do have, like Patty enters all of the applications once they're received, or the septic applications get logged into a database too. But we haven't really kept track of how long it takes to get to those, but we do have timeframes that we're supposed to operate within. So.
And
for
that's
all of
something that you
those.
manage with the team, kind of making
Yes.
sure that you're operating underneath that threshold.
Yes,
So I was asking about the throughput, like a measurement from average time to submission of request or permit and the date it's completed. Just as, you know, as the county continues to grow, you know, that's kind of like a key indicator of, hey, we're processing and we're keeping up with the volume, you know, as opposed to, yeah, we did 89, but I'm not saying there is, but there's 200 left to do and they're aging and some of them are 30 days alive, you know what I mean? Can't really see it here, but that
Right.
comes to mind is that that gives you confidence and anyone looking at this data, confident, like, hey, we're managing the increase of volume because our average days to turn around is 5 and we check them up. Just an idea, just a curiosity. Sounds like you have thresholds and you're managing to it.
We do.
Just okay. Great, thank you.
That's all part of this whole clinical, or this whole activity report that has been evolving for the last 2 years, 2.5 years. It's certainly different than it was when I first started, and I think a lot more informative than it was before too, with much less fluff.
Mm.
So I'd like to get it to be even more concise and precise and do those types of metrics. And I think Gillian has it in her head, and in fact, I know she does. She knows exactly what's out there and how quickly her staff's getting towards it. So putting it on paper probably would be the next step, and making it very concise and easily digested by people who aren't part of the system.
Yeah.
So I like your ideas.
Yeah.
Any other
Any
questions?
other questions for, if there's none other for Gillian, I'll move over to threat preparedness.
Is this before we move on, is this the part where we lament Julian's resignation? And is there any way we cannot accept it? As a board?
Well, we'll still have her for our next meeting, right? On our based on our schedule.
Yes.
Yeah.
You're not quite gone yet.
No, not yet.
Well, good luck on your next year. We'll see you next month, but
Okay.
best of luck.
Thank you.
Want to move on to threat preparedness?
All right.
Okay.
Yep.
So Brandon is out today. So I would be the threat preparedness person. So we are continuing complying with the requirements that FEMA has and the state has on us to make sure that we're up to date on all our training. So I just learned yesterday that Dr. Reedy and I believe the sanitarian supervisor and I believe the nurse director all need to do one more additional training and certification through the incident command system program. So ICS 2200 will be one more. I thought I was done. I had already done all 6 of them or 7 of them or 8 of them or whatever there are. But now I will be doing a couple more. So he's actually very thorough and has found some things that we probably should have done previously that we are not yet compliant with, which we will be in the next month or 2, hopefully. So can't wait. ICS 2200, whatever that is.
A really boring course, I'm sure.
I actually learned a lot in ICS 300. I think Dr. Reedy did too. And I was a little bit surprised at what I learned.
That was an in-person course, wasn't it?
That was an in-person course. Yes, that was not an online course. So we actually did learn a lot. But other than that, there's not too much going on. We are doing some threat preparedness grant requesting some grant money to be reapportioned to different types of things because some of the grant money was applied to our coordination with the state of Maryland and Washington, DC to be participating in their every 5-year program of bioterrorism program and their bioterrorism training, but they only have to do it every 5 years and they've deferred until fiscal year 25 on that. So we need to reallocate some of the funding that we had requested for that, but we'll be doing that in the next week or so. And that's all for the threat preparedness.
Thank you. No other questions? We'll move on to the clinical report, please.
For our clinical side, there's not a lot updates. We're doing as expected, vaccinations, family planning, sexually transmitted disease infections, and TB. Pretty much we're at where we're expected. With my nurses, they are currently in a rotational training. They're all going through, because we had spring come over recently as our 3rd LPN. We're going through a training where everybody's getting orientation to each program. So they all would be able to do all tasks very easily, especially if someone had to call out. And then with our QRT, we've made some progress, laying the groundwork of meeting and creating networks throughout in downtown Charlestown, Shepherdstown, meeting agencies in the county, and our team has been very active on that. trying to establish more connections throughout the county. So that's what we're after.
Thank you. Any questions? All right. None. We'll move on to Dr. Reed with Health Officer report.
I don't have a lot to add. The change to doing more insurance billing, private insurance billing for family planning and other services continues. That requires approval by each specific insurance company of each provider, and that can take months to achieve. And it's for our staff learning some new billing codes and processes. We've had several conversations with Jefferson Community Ministries about us participating in some of their events and them offering us space for our peer recovery coaches or nurses to provide some services there. And we're in the process of doing that. And whether we expand that to be another site that we're officially offering for pay services, that's something that we would have to get approval. For example, if we were to do family planning services there, we would have to get the program to do it. If we were to build private insurances, they'd have to approve that as a site. So it's all the nitty gritty for one visit a year. It's certainly not worth doing that. There are a lot of services that we do that would not get paid for anyway. And if we can provide more of them by being near the population center, that's what we want to do. But that's a work in progress, but there's so many areas that our clientele and theirs overlap, that it's a, and they have more social work services that it's feel good about that. So no other new initiatives. We are working to get some collaboration also with them and others on having recovery program for opioid. I suspect in the next couple weeks we will have guidance from the county commission on the timeline and process for applying for that funding. So that's going to probably be within the next 2 months. We'd have to have a proposal. So we're forming alliances right now, but don't have any draft money proposal or anything like that. Any comments from the board, now or later, would be greatly appreciated just as we move forward. And I'm done.
Any questions for Dr. Reedy? All right, we'll move on to Gino.
Fun stuff. So as noted earlier, moving Spring back into her licensed practical nursing position from her office assistant position. So we are looking to fill the office assistant position on the clinical side. Usually there's 2. There's 1 right now. We have interviewed 3 out of our 5 candidates, with 2 more coming in on Monday. Which reminds me, we are off on Tuesday for primary election day. That is a state holiday. All you private sector people, too bad. I never heard of it before until I started here, so.
Not
I
all
used to
states
I used to
do
go in and vote at like 7 in the morning and then go to work.
You can stroll in at 11:30.
Yeah, now I can go sleep late. So we will be posting, I already have the sanitarian supervisor position, or Gillian's position, up on the DOP. I have not yet activated it yet. And the reason why I have not done that is because I don't want to start too early, because the starting date will be late June or early July. So we want candidates, but I don't want to scare any candidates away who might say, well, that's, 7 weeks away. I may not want to apply for that. So I'll probably post it at the end of this
7
coming
weeks
week.
isn't that long.
It goes quick, but it might scare some people away.
And I kind of like to be involved in the interview.
You will be,
So,
you will
well,
be
not if you
interviewed.
post too late.
no, it'll be posted actually, officially posted. It's already been created. I just haven't, made it active yet.
Okay.
We continue to be able to retain employees, that has increased personnel expenses, but has also contributed to increase in services on both the environmental and clinical sides. As you can see from the clinical side, revenue is greatly increased and has increased every year since fiscal year 21. So yes, it's more expensive, but yes, we can provide a lot more services. We can provide a lot more inspections and a lot more permitting and on a much quicker basis. And I know this for a fact because I've heard it from restaurateurs who've told me that they're getting inspections that they hadn't had in a long time, that they're coming in more often. And I've also heard it from well drillers and septic installers and some of my friends who are builders that they're getting a lot quicker turnaround on their permits. So.
That's great.
So we've been able to do that, and that's a testament to what Gillian's done, but it's also a testament to our ability to retain staff. I don't really have much else under health administrator report, so we should probably move on to the next item. It's up to you, Karen.
Go for it.
All right, so this is the fun part. This is why everybody's here today, right? Let's be completely honest. So you should all have in front of you a printed copy of my PowerPoint, which I will jump up to the computer and move through with alacrity, hopefully. Couple things. Let me share this real quick. Isn't that lovely? But hopefully. And maybe dead finally up there. Oh, look at that, as soon as I say it.
Just flash it off.
So, couple of things that I think are extremely important for discussion on this is, newer change positions for fiscal year 25. Since we added that fourth field sanitarian or fifth sanitarian, when including the sanitarian supervisor, that began working on January 2024, as we all know, it was Mason. The environmental department is now fully staffed according to most metrics used in public health. So we did add a third licensed practical nurse. We brought that individual over from her office assistant position because we are seeing an increased demand for clinical health department services. That includes not only women's health services, but that also includes immunizations and some of the other things that we're doing, especially when it comes to the quick response team or our opioid program. So I wanted to make sure that we had enough nursing staff to be able to ensure that any people calling out sick, we don't have to discontinue service that day. We have enough people to cover for that. And that's exactly what Lindsay's doing by making sure that all three LPNs are interchangeable and being cross-trained. So unfortunately, I did remove the epidemiologist position from fiscal year 25. As the amount of work did not warrant a full-time position. It was great to have an epidemiologist, and it took a little bit of weight off, and it's an excellent support position, and it helps a little bit on the environmental side, it helps a little bit on the clinical side, but I probably estimated we saw maybe 8 to 12 hours on a weekly basis that was true epidemiological work, and I didn't think it was worth continuing to fill that position until we become a large enough community. Like Berkeley has a full-time epidemiologist, but they're also 3 times larger, than almost 3 times larger than us, or 2.5 times larger than us. So I wanted to make sure that we could save on that and apply that expense to other positions that are much more important to providing service to the county more directly. One of the fun, I love a good pie chart. So just quickly here on the pie chart, just to show everybody how much state revenue typically would be providing for the share of our revenue in fiscal year 25. It's probably about 32-33% of total revenue comes from the state, with an additional 8% coming from the federal threat grant. Other than that, you can see clinical services and environmental services account for roughly almost 50% of all the revenue that's generated by this particular organization. That's actually quite a bit above other types of public health agencies and other health departments, whether in the state of West Virginia or outside of the state of West Virginia. So we're actually not self-sufficient, but we're much more self-sufficient than the average health department. Quickly, I did want to mention here on the partnerships, Dr. Reed did discuss that. So we will be collaborating with Jefferson County Community Ministries to assist Jefferson County with the substance use disorder services and counseling. This is going to take the form of a broad coalition of county organizations. And this will be separate from the Jefferson County Health Department operating budget, and will utilize funding from the West Virginia opioid settlement funds, including those that will be made available from the West Virginia First Foundation. So as Dr. Reedy said, we don't know exactly what our proposal will be. What we're doing now is we're forming a coalition of like-minded partners, starting with the two main partners, ourselves and Jefferson County Community Ministries, but we will be including other partners within that who are currently working in the substance use disorder field. So
Exciting work.
yeah, unfortunately necessary work.
And this, I was gonna say, and necessary, yeah, I agree.
So here's the really fun part. You guys have that in front of you. Let's start with a couple things, couple assumptions. Unfortunately, if anybody who understands economics, there's a lot of assumptions in economics, and budgeting a lot of times there's a lot of assumptions in that. First line item here is state aid revenue. Currently, actually first line item is the 2025 proposed with the 18 employees, 18 full-time permanent employees. One less than we have at this current time now. This first proposal is with no environmental fee increase. Second thing is the assumption that a flat state aid contribution, so no increase in state aid, same number that we received in fiscal year 24 is the assumption right now. I'll get into the weeds a little bit on that. As we all know, if you follow West Virginia state politics, there probably will be a special session coming up very soon to address the budget and the differences between that House budget, Senate budget, and the governor's budget. So in last week's Association of Local Health Departments meeting, Craig Blair called in, the state Senate president, and assured us that he is going to go through with the governor's budget, which would increase the public health budget for local health departments in the state of West Virginia by a little bit over $2 million, or roughly $2 million. So that would be anywhere from an 8.5% to 11.5% increase in our state aid, depending on how the formula works out. I can't, without seeing the new formula and all the coefficients and all that, I can't be sure exactly what that number will be. So the next thing is there will be no county aid. We all understood that the county was a little strapped for their budget moving into fiscal year 25. They proposed a no aid again, and we'll go with that. So the next line item is the clinical services revenue. And although we've been powering through clinical services revenue this year, I'm going to be conservative again and go with an average of the 3 post-COVID fiscal years. So I'd expect somewhere in the range of about 372,000 and 370,000 in clinical services revenue in fiscal year 25. Currently, as of the end of April, we were running at $381,000 in clinical services revenue. I prefer to be much more conservative on my revenue expectations, so I went with a little bit lower than what we are currently running. So anything can happen, bad things can happen. People have a lot less money come and stop coming to visit us. So I want to make sure I reduce that amount. The environmental fee permits, as we discussed earlier, I left those flat. Currently, in 2023, we ran 267,000. Currently, we're running about almost 260,000. So I suspect we'll probably hit somewhere in that same range. Again, I did an average of the 3 post-COVID fiscal years to come up with that number, to try to be conservative, but also to keep in mind that since COVID, numbers have changed. So also the next line, environmental fee services, if you'll look to the far left in fiscal year 2020 and fiscal year 2021, you'll see those were the 2 years that were prior to the NEHA grant. So I removed the NEHA grant out of fiscal year 22, 23, and 24 to get a more solid number without it and come up with something around 55,000, which is probably much more in line with what will be going forward. So the next one is the federal grant threat prep. I've already been informed it's going to be at least a $3,600 increase or almost $3,700 increase. We're still waiting for the Center for Threat Preparedness with FEMA to provide the final numbers because we receive an additional funding from the federal government as we are a county that is in the Washington, Baltimore metropolitan area, as opposed to any other counties in the state of West Virginia. So we receive a little bit more, so it'll be at least a minimum of $3,600 increase, but it'll probably be an additional 2,000 to 3,000 above that. One of the things I wanted to do was I wanted to remove the QRT grant from out of clinical services revenue. We've roughly brought in about almost $100,000 in the past 3 quarters in this fiscal year from the QRT grant. And I'd like you to know that the QRT grant covers up to 45% of the nurse director salary, as well as 100% of the peer recovery support coordinator, 5% of the administrator, and 7% of the health officer, which I've so far billed out every quarter so far this year. So we've spent about $100,000 on the QRT program, and those are two of the payments that I'm still expecting. So about roughly two $50,000 payments from
How
state of West
often does
Virginia.
that grant have to be renewed?
That will carry us until August of this year.
Yearly.
It's an annual. And it's increased. They are encouraging us to provide even more service, but I don't want to ramp up too quickly because we incur those expenses long before we get reimbursement on them, and that always makes me extremely nervous. So as my staff knows, when we start getting close to the reserve, can get a little wacky. So I want to going forward. I think I'd like to report that out separately from clinical services revenue, and I think it gives us a truer indication of what we're actually doing on the clinical services side without that in there, even though that is technically a clinical service. So I wanted to put that out there so you could see it as a line item in the budget. The next line item is the other category. Those are donations, interest, rebates, and smaller grants. As Gillian spoke earlier, NEHA is still providing grants to us that offset some of our costs, not personnel expenses, but some of our other costs. And we're expecting probably somewhere around $49,000 in the next fiscal year from those grants. They're broken down into roughly a $24,000 and another like $5,000 grant, something like that.
Mhm.
So we expect like I said, about $49,000 from NEHA to cover some things. So get to the beautiful part, the expenses. Talking about 1.25 million in personnel expenses. If you didn't hear, PEIA has done a 3rd annual increase. This one was 14%, not as much as the 22% from last year, but still a significant increase considering a large portion of our employees carry PEIA, and we do provide employee-only coverage. So that was something that was voted by the board, I guess, about 7-8 years ago.
That's in insurance, I'm assuming.
That's, yes, okay, I'm sorry, it's the public employees insurance agency.
Okay.
So yes, so that's health insurance. And then last but not least, general operating expenditures. I went with the average of the 3 post-COVID fiscal years, plus I added in an additional 5% for inflation and things like that. There will not be another clinic room upgrade. It looks great now. I don't anticipate doing anything like that. However, it appears we'll be granted more office space in this building, and it hasn't been officially announced yet, but it's been back channeled to me. It would be the rooms directly behind you, and that would provide us with an additional 4 offices. And I imagine there will be some cost associated with moving into that. After all, we're not an official county agency. The county maintenance department does treat us extremely well and provides a tremendous amount of service at no cost to us. But certain things they do require us to pay for. If we had to change doors, if we had to, create a new bathroom, things like that, then those things would fall to us. So I will make sure after a few meetings ago, that I will come to you and give you an idea of what any type of increased operating costs based upon our move into these offices may entail, and make sure to get your approval for that, okay?
And that 5% increase is kind of
That's an inflation thing.
an anticipation of some of those?
Nope, strictly 5% based upon the fact that things have become so much more expensive, internet's more expensive, office technology services through the state has become more expensive.
So in other words, there aren't any budgeted funds, at least in this model or this presentation for
For renovation.
potential renovation.
I'm not expecting them,
Yeah.
it is a possibility,
I
but I'm
gotcha.
not expecting. them.
Okay.
So there's a lot of assumptions in any type of budget like
Yeah,
this.
yeah.
But I wanted to throw that extra 5% in specifically for inflation reasons. As you can see, the 2025 budget proposal is flat on state aid. I'm pretty sure that will go up. It is, and it's also based upon an average of the previous year's environmental revenue and environmental permitting and services. So if you look to the right of that, you then have all the same assumptions with an increase of roughly, we estimated, running through the numbers, is actually probably would have an impact of about 16%. So that quote unquote 20% across the board permit fees actually equates to about a 16% increase in environmental
Because it's not
permitting.
across the board.
Yeah, because it's not across the board, and certain things are not all the way 20%, and certain things are not being increased. So we can't just say, oh, all environmental fee permits are gonna go up 20%. So we did some mathematics to see what a safe assumption would be, and we came up with about 16%, a little over 16%, but we went with 16% as the number to use for an expected increase. And what you can see is it at the bottom, in the 2025 proposed, we're running a slight deficit of $15,000, almost $16,000, but with the 2025 alternate, with the increased environmental permit fees and service fees, we're running a slight positive of almost $35,000.
Do we know how many counties in West Virginia receive county commission funding?
It's over half. It's over
The
half.
majority.
Yeah, it's the majority, and then some receive even additional funding beyond that, where they have a levy.
Mhm.
Like, Cabell Huntington County does, I believe, also Monongalia has a levy. I think so.
There's several counties that have levies.
Yeah,
too.
the bigger counties typically have levies. I don't think Berkeley County has a levy, though.
So yeah, most of them either have a levy or county funding, and some have both, so.
And municipal funding too, for like Cabell Huntington, they also receive funding from the city in addition to county and county levy. So it's very different for us here, but we're doing a good job of managing, driving revenue and managing expenses to keep us in the black. We're in the black this year, I suspect. As you can see in our year-to-date actual, we're running a little bit over 120,000 net positive. And that's in line with our previous net positives in the previous 3 fiscal years. I doubt we'll run 120,000. We'll probably run somewhere in the $40,000 to $50,000, maybe up to 80, like in the approved budget. But I don't think we'll end up at $120,000 surplus at the end of this year. So, but what I don't want to do is I don't want to sugarcoat the fact that expenses are going up. Salaries are going up, benefits costs are going up, and it's possible that CPRB, which is the Consolidated Pension Retirement Board, it's possible that they go from 9% match back to the 10% match, which was up until fiscal year 22. So that would also increase our expenses probably about $60,000 to $70,000 over the year in personnel expenses. So if CPRB decides to go back to a 10% match versus a 9% match, that could really impact us too going forward. But
Would that be, Gino, would that be in fiscal year 2025, or would that be something they have to wait to institute till fiscal year 26?
That would be fiscal year 26, so it won't impact this
Okay.
current one, but it always, in my mind, this is a continuous thing, and we've been able to run budget surpluses the last 4 years or 3 years plus potentially this year. I would prefer to run a zero budget or a slight positive if I can. But right now, with the way things are, I can't, honestly estimate that we will be at a zero budget or be at a positive going into fiscal year, at the end of fiscal year 25. Not without an increase in state aid and not without an increase in our environmental fees. So what I would ask for is approval of, unfortunately, a slightly in the red budget proposal for fiscal year 25 with an eye towards flipping that number a little bit based upon what happens at the special session for the budget at the state, and also pending an increase in permit and environmental fees.
I mean, it seems to me the only difference in the alternate and the proposed is the environmental fee increase, and isn't there a large degree of confidence that that's gonna be approved?
I don't anticipate that the county commission would.
It's ultra conservatism, I didn't mean to interrupt.
And if you remember, and Ann and Dr. Reedy and Gillian have seen me make these proposals before, I tend to be extremely conservative on these,
Yeah.
on revenue especially. And tend to overestimate where I can, expenses, and obviously I missed expenses this year. They were much higher than I had anticipated. A good bit of that is vaccine and other, you know, I guess you could call them, a decision to spend money that wasn't allocated or wasn't approved, so. That won't happen again, but at the time it felt like a good idea, so I'm trying to be.
It was a good idea.
I'm
The
still,
frameworks are important, but you still have to operate the department, and that was necessary, so I don't want you to yeah. But I think going forward, having it budgeted and in case there are any questions, awareness is good. I'm almost like, is it, and I appreciate the ultra conservatism, but that seems to me like not a big stretch on the environmental service fees, and then the conservatism is baked in on almost all these line items, and to account for that, and maybe even a portion, maybe it takes 3 or 4 months instead of 1 month, you know, and it's not the $45,000 differential, maybe it's only 30, you know, maybe you're accounting for a portion of the years of that. But
Right.
to not include it and go with the negative, now I don't have the experience that the rest of the board members do on approving a negative, a deficit. You know.
they've been approved before, haven't they?
Yeah.
I do anticipate that the county commission will approve the increase in fees. That's what I would expect.
And we can come back, I'm more than happy to I'll be very happy to come back with an amended budget that increases revenue. But as of right now, sitting in front of you, you asked me, these are the numbers I expect. Somewhere very close to these numbers, not somewhere close to the alternate budget, or an increase of 8.5% to 11.5% in state aid, which would add another like $50,000 to the revenue side. As of right now, this is what I'm expecting, and I'm sure Karen has her finger on the pulse of West Virginia and how the budget debate has been rolling out over this year. So I don't know if she has a better idea than what Craig Blair has, but she may.
No, I think it's comfortable. I think the only question I'm comfortable with all of this. I just think the only question I probably don't want to put too much weight on the county commission probability. I think it's probably a 50-50. I think you guys have justified the cost very well. But I just, at the end of the day, they're an elected body, and the decision's ultimately going to be up to them. I guess my only question is sort of in the timing of this, because I think, Gino, we need to submit this by what date?
Before the end of the fiscal year.
State?
Yeah, preferably June 1st. I received the template for the program plan. And the program plan does expect to have a Board of Health approved budget in it. So that's June 1st, no later than June 30th.
Okay.
And I'd like to give it to them by June 1st. I wish I had been able to get this type of budget to you guys in April, but without any state wouldn't even release, they wouldn't even come to us and say, expect a flat state aid. this coming year. They wouldn't even tell us that. So the fact that they were able to actually say, you should anticipate a flat, that helped a lot. So that was, it's the largest line item on the budget. So I wanted to make sure I had some type of assurance that we would be at least receiving that before I came to you. That's why it's about a month later than I would have liked.
So when did you tell me the legislative session
It's
is?
not yet been called,
Okay,
but the governor did mention earlier this week that he was hoping to call it next week or the following at the latest. I've been following that. So I
I
would
mean,
still,
Yeah.
say the 25 proposed with a slight deficit is what I would put forward as my official budget from me. Unfortunately,
yeah, I'm aligned with you on that one, Gina. I'd rather be safe than sorry, and
absolutely.
with your, conservative numbers in the other fronts.
Well,
$15,000 should be pretty fine, and if those assumptions end up off, I think this is all fixable through, managing some of the operating expenses as well throughout the year as we get more tangible numbers to work with.
Absolutely. And I would show you real quickly how much personnel costs can go up year over year. If you start looking from 22 to 23 to where we are in 24 and where we're anticipating in 25.
Oh, yeah.
Staff retention is important and being able to provide those services, but yeah, staff is not cheap,
and we were severely understaffed. in
severely
In
understaffed.
2020.
Yep, 2020 going into 2021, this office was extremely understaffed. We didn't really run a full fiscal year with a nearly full staff until 2023. And even then, we still ran a nice little surplus. Right?
One comment is, though, this includes the third LPN salary,
It does.
which is I
Significant
look at it
increase.
as an investment, that gives us then the capacity to expand clinical services. But you did not put in any increased revenue so we haven't realized that.
No,
It's an investment, so this shows the expense, but not any.
Right, and I
return
think,
yet.
yeah, that
It's
goes
gonna
right
show
back
up
to
much.
the conservatism. Yeah,
wanted
because I
to-
question that too, but I appreciate your approach and I trust the wisdom of the board and the experience with approving a deficit.
So do we need a motion to approve this?
And specify which one.
I move that we approve the 2025 proposal without the increase in the environmental fees, with a deficit of $15,711.
I have one more question.
Please, Elliot.
Actually, Elliot, we've got a motion on the table, so if there's a second, we can address that in the discussion.
I second.
Right now, discussion. Go ahead, Elliot, please.
Okay, Gino, you're getting more state aid than you anticipated and zero from the county. Could you just posit maybe some sort of opinion as to what you think would be an appropriate contribution by the county in case there are issues down the line? What should we be looking for to get from the county going forward is really my question.
So previously, as discussed last year around budget time, previously the county had provided up until 2010, they had provided $242,500 to the county health department. Really the most important thing would be able to afford the fifth sanitarian, or the fourth field sanitarian. So somewhere at the minimum, somewhere in the $75,000 to $85,000 range with, salaries and benefits and all of that and mileage and all of those things. That would be the minimum side if I were to say, what is the absolute minimum I think that the county could come up with that really help us going forward. I would go with that, to be able to at least support the position, the sanitarian position that is no longer being supported by the NEHA, the National Environmental Health Association grant. So, which was 76,000, so somewhere in that 75 to $85,000 range would probably be what I would say would be a welcome contribution from the county.
Right, because grants aren't a truly reliable source of revenue
Absolutely.
on a recurring basis. So, but your local government should be. So, all right. Thank you very much.
You're very welcome. Thank you, Secretary Elliott.
All right, any other discussion? All right, is there, all those in favor of approving the 2025 proposed budget with the $15,711 deficit, please say aye.
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 Aye. All right, the motion passes. Thank you for this work, Gina. It was excellent.
Thank you. I do want to say I will come back with a revised budget in hopefully July. That would be wonderful. And I might even have a revised budget by June, based upon whatever the state budget discussions go on over the special session. So I'll come back to you with that.
Do you really want to wait and just present it to the state after the June meeting? You want to go ahead and send it?
I think from my experience dealing with government earlier, you get the paperwork to them so that they can start processing it the better. If you have to amend it later, I think that's more appropriate to do.
Okay.
One last question for you, Gino. With
Sure.
the proposed environmental fee increases, are you going to be going to the county commission to present basically the history that you and Gillian have outlined behind this proposal? Are you going to be presenting to them?
I
The
will.
why?
Yeah, I will. I'll present to them the why, just like we did last time. But I suspect I'll be asked to be in front of the county commission to be able to justify. I would love it if Gillian will be there, but she may not be here by then, so whoever the new sanitarian supervisor is will have to sit next to me.
So does the request for the county commission come after the 30-day public notice?
It does, and it comes after your Board of Health approval,
Okay.
after the public notice.
Okay, thank you. All right, I think that rounds out our agenda for today. Our next meeting, I can't remember. Our next meeting will be July, my goodness, June 14th at 9 a.m. So, all right, is there a motion to adjourn?
I move we adjourn.
Second.
All right, no discussion, I assume. All those in favor say aye.
Aye.
Thank you.
Aye. Thanks, everybody.